Today, we're diving into one of the biggest shakeups in modern medicine, artificial intelligence. It promises this amazing future with faster diagnoses, cheaper treatments, and just better outcomes for all of us. But as we're about to see, this incredibly powerful new tool comes with some serious hidden dangers that we absolutely cannot afford to ignore.
I mean, just look at this. This isn't science fiction. This is happening right now. An AI built by Google can spot diabetic eye disease from a simple photograph of your retina, with the same accuracy as a whole team of doctors. I mean, think about that. This could prevent blindness for millions, especially in places that don't have enough specialists. It's an incredible peek into a future where AI helps us all live healthier lives.
And here is the flip side. This is the central tension of the whole thing. The exact same technology that holds so much promise has a bit of a dark side, because the data we feed these amazing systems, well, it isn't neutral. It's soaked in all of our history, our inequalities, our biases. So the real question we're tackling today is, how do we use this immense power for good without just making the flaws already in our society even worse?
Okay, so first, let's just appreciate the incredible things that are already out there. AI isn't some fuzzy concept for the future. It's being used in clinics and hospitals right now, today, and it's completely changing the game.
And I mean it. These are not hypotheticals. In the UK, you've got an app called GP at Hand that uses AI to check your symptoms. Over in Copenhagen, there's a system that helps emergency dispatchers detect a heart attack just by listening to a caller's voice. And like we said, AIs are analyzing medical images with, frankly, superhuman accuracy. These tools are already taking pressure off staff, bringing down costs, and literally saving lives.
But, you knew there was a but, right? Like any huge technological leap, this one has side effects. The very thing that makes AI so powerful, its ability to learn from enormous amounts of data, is also its biggest weakness. There are some real ghosts in this machine that we have to talk about.
Now, the research points to a few core problems, things like accuracy or the whole black box issue where we don't know how the AI got its answer. But for this explainer, we're going to focus on the one challenge that really sits at the heart of all the others, the problem of flawed and biased data. Because this gets right to the core of the ethical mess we're in.
Technology is never truly neutral. It's always shaped by the choices people make. And for machine learning, the biggest choice of all is the data you feed it. There's an old saying in computer science, garbage in, garbage out. Well, when it comes to our historical medical data, it turns out there's a lot of hidden garbage.
And this chart just says it all. A truly groundbreaking AI was created to detect skin cancer. Amazing, right? But look at the data it learned from. Less than 5% of the images were of dark skin. So what happens? Well, the model is almost guaranteed to be less accurate for a huge part of the population. This is what experts call sample size disparity, and it can lead to outcomes that are not just unfair, but flat out dangerous.
Here's a good way to think about it. Imagine you're a med student, but your only textbook, it only shows diseases on one skin tone or in one gender. You'd be a pretty terrible doctor, right? Well, an AI that's trained on biased data is exactly the same. It learns a warped, incomplete version of reality.
Okay, get ready for this, because this example is wild. Researchers built an AI to predict who was at the highest risk for pneumonia, and overall it was super accurate. But it made one, frankly, terrifying recommendation. It said that patients who also had asthma were low risk and should just be sent home. Any doctor on the planet knows that is dead wrong. So what on earth happened?
Here's the crazy part. The algorithm noticed a pattern in the data. People with asthma almost always had great outcomes with pneumonia, but it completely missed why. The reason is because doctors knew they were high risk, so they'd send them straight to the ICU for aggressive treatment. Their files never showed a bad outcome, so the AI learned a correlation that was technically correct, but in the real world, it was life-threateningly wrong.
And this is the point that really matters. Why is a mistake made by an AI so much scarier than one made by a human? Well, when a doctor makes a mistake, it's a tragedy, but it's usually an isolated incident. An algorithmic error, on the other hand, one that's baked into a system used in thousands of hospitals, that's systematic. It's an error that can be scaled up to harm millions of people at once, creating a massive public health crisis before anyone even knows it's happening. So, of course, this leads us to the huge, messy question of accountability. When one of these complicated, kind of opaque systems gets it wrong and a patient gets hurt, who's responsible? Is it the doctor, the hospital, the tech company that made the thing? This is where our legal system is really scrambling to catch up.
So let's just ask it directly. Imagine you're the patient. An AI-powered diagnosis leads to the wrong treatment, and you're harmed because of it. Who do you sue? The answer is incredibly complicated, and it really shines a light on some major gaps in our current laws.
Okay, so generally speaking, a patient has two main legal paths. The first is to file a negligence claim. That's against the human using the tool, the doctor or the hospital. And the core question is, did they use the AI reasonably, like any other professional would? The second path is a product liability claim. This one goes after the manufacturer, the company that built the AI. And here the question changes to, was the AI itself a defective product?
And boom, here's the legal bombshell. Our product liability laws were written for physical things, stuff you can hold. Standalone software, especially something you just download from the cloud, it doesn't really fit that old definition. And if a court decides the AI tool isn't legally a product, a lawsuit against the company that made it could just get thrown out. This is a huge, dangerous legal gray zone. It leaves patients unprotected and might even make doctors afraid to use new tools because nobody knows who's on the hook if something goes wrong.
Okay, so we've got this incredible tech, we know the risks, and we've got a legal system that's playing catch-up. What's the way forward? Do we have to just tear up all our old rules and start over? Well, the author of the work we're looking at, Daniel Schumberger, he suggests a much more thoughtful approach.
The main argument is that our existing legal and ethical rules are actually pretty solid. We don't need to throw everything out and start from scratch. But, and this is a really big but, we do need to make some very targeted, specific updates, especially, he says, when it comes to non-discrimination and, as we just saw, product liability.
So what does that actually look like? Well, first, we just have to admit it. Our data is biased because our society has been unequal. That's step one. Second, we have to demand transparency from the companies building these tools. How are they trained? How are they tested, especially on different groups of people? And third, we have to update our laws so that when medical software causes harm, the company that made it can be held accountable, just like the maker of a faulty pacemaker or any other medical device.
And that really brings us to the final thought here. AI in healthcare isn't a matter of if, it's a matter of how. It's holding up a giant mirror to our medical system and our society, showing us both our amazing progress and our deepest flaws. The real challenge here isn't just about technology. It's about us. It's a deeply human problem. How do we program our best values, our ideals of fairness and justice, into the very code that's going to shape the future of our health?